Hi and welcome. I am trying to learn medicine, today enlarged adenoid, and after we've done with it, we're gonna do squat training, and if you participate in the squat training, then it's better if you're honest. Now, this is part 6 or something of the enlarged adenoid. We're gonna say, the adenoid is at the back of the nose, at the region of the back of the nose, where it joins at the back of the nose, at the beginning of at the back of the nose, at the back of the nose to the mouth cavity, and it is lymphoid tissue. So, and that lymphoid tissue is there to protect the body from infections. And when the adenoid is infected and enlarged, I said it is infected. Okay, we're going to stay with enlarged, but I think it was infected somewhere. If the adenoid is enlarged, then it can block the eustachian tube clearing the middle ear to the nose. It can block the opening to the nose, the enlarged adenoid, and then that can result in otitis media. And also can it be that a person can only breathe through the mouth then. And that makes the tonsils get larger at the end of the... No, I'm not going to say what it is. If I would say it, what would I say? In that region, which are in that region, and the tonsils which are there in the mouth cavity. I don't know if they're in the mouth cavity, which are also up there by the enlarged adenoid. Let's try to say it. The symptoms are mouth breathing and a blocked nose, and also nasal speech, and deafness and recurrent otitis media, and snoring. Mouth breathing and blocked nose, deafness and recurrent otitis media, so inflammation of the middle part of the ear, and snoring and deafness. I just say it, snoring and nasal speech. That whole thing, if I would say it, can last for months or years. Causes recurring or long-standing infection of the adenoid, and the adenoid can be enlarged through recurring or long-standing infections. Then it can be removed, the adenoid, and possibly also the tonsils. And then the recovery is usually rapid, but it will be tried to reach a balance of symptoms and the age of patients try to be reached, because it is mostly in the early childhood and resolves more or less when. It reaches maximum size at about the age of 8, and by puberty no longer causes obstruction. Let's try it. It's not that long. If you mess up, we're going to do it again. I have a second camera, so I'm going to sit now. That's an enlarged thing. Enlarged adenoid. The adenoid is at the end of the nose in the mouth cavity, and it can be enlarged through recurrent infections or long-standing infections, mostly in early childhood by young children. Now, and if it is enlarged, then the eustachian tube clearing from the ear to the nose can be blocked at the place where the eustachian tube comes to the nose, and then it can come to a recurrent otitis media, so inflammation of the middle ear. And also, can it happen that then mouth breathing is necessary because the nose is blocked from the enlarged adenoid, and that can result in the tonsils becoming larger. The symptoms at all are then mouth breathing and a blocked nose, and nasal speech, and snoring, and deafness, and recurring otitis media. And also that whole thing lasts up months and years. And it can be removed, the adenoids, which is lymphoid tissue. So lymphoid tissue is there to protect the body against infections. Now, but these adenoids can be removed, but that is a decision because most of the times it goes away when the child gets older. If it is helpful to remove it or not, that is a decision which has to be made. And that is according to Keith Hodgkin's Family Medical Advice on page 63 and 64, but this is no medical advice. I don't know what the thing is anymore. It's an adenoid. Not an adonis, so an adenoid. I don't think I said it wrong. And as I said in the previous part, maybe it is even a bit good that it is a little bit from left to right, because it's not so much. This is not medical advice, so it is not that people listen to it and get medical advice. Maybe it is very good that it is even a little bit chaotic. I'm going to stop the second camera. And that was a medical part. If you were here for medicine, you could go directly to the next part of the medicine. We will do now a squat training. If you stay and participate in the squat training, that is at your own risk. What are we doing? We're bringing one leg up and pointing the foot down. Your foot up and down. And down. And into the outlet. And the other leg up, point the foot down. Up and down. Turn it. And now to the side. And just pulling forward and just touching the inner side of the leg. And out of the other side. And we're going from side to side. And into the middle. And now we're just doing 12 squats. So legs wide apart and we're going down. That was the first one. And the second one. And number 3. And 4. And 5. And 6 was also half. And 7. 8. And now for 9. And 10, now are just 2, 11, and 12. And now, the 6-pack squat squeeze, legs wide apart. We're going down into quarter squat and we're pressing against the top of the leg, just on one side. And on the other side. And down into half squat, press against the middle of the leg. And on the other side. Down into 3/4 squat and press close to the knee. On the other side. And up again. And now the fastest giraffe of a water pond. We're going down into 3/4 squat. Press against the knee. And go towards the knee. And the other knee. Press against it. And go towards it. And again. And again. And again. And again. And last 2. And up again. And now, already the last exercise is the propeller. Down into foot squat. Arms to the side. Out to one side. Press against the leg and look up to the leg. And into the middle, out to the other side. Press against the leg, look up to the head. In the middle and up. Now walk on the place. Bring the leg up, point the foot down. Other leg up, point the foot down. Take the leg at the ankle. Make a straight leg, point the knee down. Other leg, take it up. Take the leg at the ankle. Make a straight leg, point the knee down. And legs to the side, breathing in your down. And out. Okay. We can cross the legs. And breathe again out. That was a squat training. I thank you very much, and until next time.